The word unprecedented has been repeated over and over again since the first outbreak of the novel coronavirus was reported last year. The scale of infections, their economic impact, and the severe curtailing on mobility had all come as a first. However, another first, which is seldom talked about, was the first global coordinated response to fight back. Namaste and welcome to New India Junction. I'm Nivedita Tiwari and we are here to discuss the good news of COVID-19 vaccines in India. In our earlier report, we had explained the advances that were being made with regard to COVID-19 vaccines, the different candidates and how they work. Since then, India has been gearing up to not only initiate the world's largest immunization drive, but also to do it with maximum efficiency and optimization. On January 3, approval for emergency use was granted to Covishield, the Indian variant of AZD1222, the vaccine developed by Oxford University and AstraZeneca. This approval was also conditionally extended to Covaxin, the vaccine developed by India's Bharat Biotech in consultation with the Indian Council of Medical Research or ICMR. The conditional nod to the Made in India Covaxin has come after the initial data based on close to 22,500 participants who were safely vaccinated across the country. After the first dry run to check efficiency and prepare for imminent vaccine disbursal was conducted in 4 states on December 28 and 29, several other states have joined the effort. As per ground reports, many states have also prepared the lists of vaccinators and beneficiaries along with identification of hard-to-reach areas. Government reports from the Ministry of Health and Family Welfare suggest that the first recipients will be the over 30 million healthcare and essential supplies workers who have been at the forefront of India's fight against the pandemic. These first responders would be receiving the vaccine free of charge. Interestingly, India's performance when it comes to vaccination has been hailed across the world, with the eradication of polio from the country being the prime example. However, some political leaders have also come out with statements regarding procedural protocols and hasty approvals for COVID-19 vaccines. These leaders have also claimed that the vaccine efforts may be politically motivated and must therefore be avoided. These statements, even as the entire country is battling the ongoing pandemic while the threat of new strains looms large, come across as irresponsible. With Prime Minister Narendra Modi himself reviewing the efforts being made by state governments as well as centers of production like the Serum Institute of India, any flouting of protocols and procedural standards seems highly unlikely. Furthermore, even as clinical trials were being run across the country, facilities like the SII have been ramping up their production to make India one of the only countries with a stockpile of doses. With even more vaccines now entering phase 3 trials, India is making an all-round effort to safeguard its population against the COVID-19 threat. One of the highlights of this process has no doubt been the efforts at self-reliance. Without the necessary push from the Government of India's Self-Reliant India initiative, the country would still be waiting on foreign assistance to effectively neutralize the pandemic threat. Looking at the current scenario and the non-stop efforts to preempt any dispersal problems, it seems like a vaccine rollout may begin as early as January itself. Until then, we urge you to maintain social distancing norms and safeguard yourself against the infection by using face masks and regular sanitization. Keep watching New India Junction for more updates. Stay safe and stay healthy. Namaste.